Insight Managed Transportation was a company we started last year. It was based on just all the behind-the-scenes work we do at East Coast Ambulance.
We were very successful in managing that to the point that one of our clients approached us and said, we need you guys in other areas where we operate. What can you do to help us out?
We were saving them so much money on transportation costs and expenses here. They wanted to know how we could do that in other states, North Carolina, Texas, Colorado. And instead of opening up an office out there, hiring employees and getting licenses and ambulances, we decided to take the management end that we do within the building here, create another company that would just basically do all the behind the scenes work with managing, insurance verification, Part A stay tracking, all that kind of stuff, get that done on our level here, and then we would farm it out to companies already licensed in other states. There's three major ones in Maryland that we're currently working with. We've worked with, are working with Genesis Healthcare, and we do all their facilities in Maryland and Delaware. Sava Senior Care, we do all their buildings in Maryland and all their buildings in North Carolina. And we brought Communicare on the beginning of this year, and we do all 23 of their buildings in Maryland and Virginia. Communicare is still in its first year, so we're still putting the numbers together for them for the annual. But for Genesis and Sava both, we reduced their transportation costs by over $1 million in their first year. I wouldn't say they're making mistakes, but I think it's a level of education that we have found.
The better way of looking at it is the clients have more important things to do. Nursing home administrators, their job is to run that facility as efficiently as possible. The more time they're spending on transportation, the less time they're able to devote to other pieces of the operation that need their attention more so than transportation.
Most facilities will have a transportation coordinator. There's a lot of training, there's a lot of value in that position. So when you hire somebody and say, I need you to set up transportation, they get an appointment, they pick up the phone, they call a service to pick the patient up, end of story. They don't know all the ins and outs of insurances, what's covered or what isn't covered. Could this patient really go by wheelchair? Because that's about a third of the cost of what an ambulance transport would be. So that's where we come in, because we look at all the diagnosis of the patient, the condition of the patient. Who is the insurance? Is it Medicaid? Is Medicaid going to cover this? Why are you paying for it? Medicaid should cover for this. So these are the things, and it's just an education. We come in and we train the staff at the facility, and we educate them on how to set the transportation up properly to reduce the cost of the nursing home and make sure the right payer is being billed. We've been doing it for so long, it's second nature to us. So we come in as a partner with any facility we work with by reducing their transportation costs right out of the gate, because there's not been one facility we haven't worked with yet that we haven't walked in and showed them that they're paying for a lot of transports that they don't need to pay for.
We understand transportation and transportation billing. We speak the language of the transportation vendors, so the negotiations normally work out a bit more favorably for us, because ultimately we know the challenges that they're going to face, and we know what the rates should be set at. And it's a negotiation from there. We
just have a level of experience that saves a lot of time, effort, and money on their end. Everything is different, so it's depending on what your specific issue is or where you're based, we will go in, look at those rules, get down to the fine details of it, and make sure that your team is following those, and if they're not, we will get them set up to follow them so that they aren't paying for things they don't have to.